Hey friends, welcome back. I'm Mark, I'm a certified health coach, and this is Teresa. She's a board certified family nurse practitioner. We're with Total Health and Wellness. We like to talk about hormones, metabolic health, and everything in between. And so the title of tonight's episode is going to be the top 7 myths of hormonal health exposed. We could have gone to the top 20 if we wanted to easily, but for sake of time, we just went ahead and went with 7. Originally started at 5, and we could have just going on and on, but we decided to keep it a little bit shorter by just doing 7 tonight. So kind of the idea behind the whole thing tonight is going to be there's a lot of misinformation around both metabolic health and hormones. So probably, in fact, I would say that the only thing that might be more misinformation being spouted from providers, institutions, meaning, different governing bodies, the U.S. government itself and whatnot. The only other industry in medicine that's probably has more misinformation is probably the vaccine industry. So anyway, besides the point, we just wanted to talk a little bit about that tonight, specifically focusing on hormones. But before we get started, I just wanted to give you guys a reminder that we have actually 4 copies of Doug Reynolds. So for those of you who don't know, Doug Reynolds is the co-founder of LowCarb USA, him along with Pam Devine. And he has written a new book. This book can be found on Amazon if you're interested in it. And just to let you know, we have no financial affiliation with this, with Doug or with LowCarb USA at all. So we're just trying to help him promote his book. The link to this book, if you want to order it on Amazon, is going to be in the description section on YouTube. And then on Instagram and Facebook, it'll be in the comment section. So if you guys are interested in ordering a copy of that, help him out, get him, bumped up in the ratings on Amazon. That would be awesome. But the announcement today is going to be that here upcoming probably next week, we're going to do a couple of little giveaways for these books. And we have 2 books that are signed, and he wrote a little note in there as well, Doug did. So we'll be giving those away. So make sure you're keeping an eye on this and stay tuned. So we'll let you know when we're actually going to do the giveaway. Yeah. All right. Well, Teresa, I'm just going to go ahead and hand it over to you.
Oh.
Yeah. So we're going to go through those seven different hormone.
Okay. So this misinformation has caused many people to not have health or life-altering healthcare because they are told whatever they're told about hormones. So people are missing out on an opportunity to help themselves with hormones. Also, you have to be careful where you're getting your information from because you can't just go to your primary or your GYN because no matter if they're nurse practitioners or physicians, because we don't get this kind of information in school. So you're asking somebody for information about something they've never been taught. It's like going to a doctor and asking about nutrition. We don't learn nutrition. It's the wrong place to go. But number one that I think is one of the big top 7 myths is testosterone causes rage. So, do you remember the after school specials in the 80s? Remember like they had a roid rage one? Did you ever see that one?
I don't remember that, no.
They had a roid rage one on an after school after school special. Mm-hmm. And the way that people do steroids in the gym, like the gym bros, are not at all giving you bioidentical hormone replacement therapy of testosterone. So like Mark's on testosterone. He doesn't walk around the house ragey and, yelling and in a roid rage.
Most of the time.
In fact, that kind of irritability and anger can be mitigated with testosterone. So many times low testosterone can bring about that irritability and anger and rage. But the way the gym bros are doing it is they're stacking a whole bunch of different synthetic testosterone along with estrogen blockers, and some of them are injecting insulin for plumping up of muscles, and they might be doing growth hormone. I mean, it's just a mess. Okay, that's not what this is. What I do say for women though is many times, and it's not just testosterone, it's hormones in general. Once your brain gets calmed down and you feel better on hormones, then you're kind of like to your husband, have you always talked to me like that? Like, we're not doing that anymore. And then the woman gets called names and you shouldn't be on these hormones and it's making you aggressive, but really it's woke her up to say, oh, I'm not going to tolerate that. Okay, but you've tolerated it for 20 years. Now it's kind of shocking to people. I just had a lady today tell me, I don't take blank anymore. And, so anyway, sometimes that can be a thing, but definitely not roid rage. Roid rage is not bioidentical hormones.
I think a more appropriate word would be assertiveness.
For sure. Yep, assertiveness, yeah. The other big myth in men with testosterone replacement therapy is that they have to be on an aromatase inhibitor, which is an estrogen blocker. And usually it's Arimidex. And there has never been one study that shows giving a man an estrogen blocker is beneficial. In fact, all studies show that it gives him ED, erectile dysfunction. It makes his lipids, his cholesterol profile go down in the toilet, and it can cause osteoporosis. Men get estrogen from their conversion of testosterone, and that protects them from bone loss. And so when you get, and there are a few lawsuits right now against providers prescribing Arimidex and blocking estrogen in men because these men have gotten osteoporosis. Mm-hmm. So that for sure, there's a lot, but that for sure is at the top of my list of tell me you don't understand hormones without actually saying you don't understand hormones. Okay, if you're blocking estrogen in men, that's terrible. The normal estrogen level in a young man, like our boy, 17, is probably around 70 to 80. There's no reason to block that. Okay. The other one is that hormones cause blood clots for heart attack and stroke. So there is a myth that testosterone in men does it, and there's a myth that estrogen in females does it. Testosterone in men was based on a flawed trial that has been retracted. So there's just, I mean, if that was the case, you would never have lived to see 21.
Yeah, I've been on it for over 10 years now. I've been on testosterone. So.
But you made the most testosterone when you were 15 to 25.
Right, yeah.
So you would be dead, okay? So that is a misnomer. And the clots for heart attack and stroke in estrogen in females is based on Premarin, pregnant horse pee estrogen, not what we use. There's never been a study that shows oral estradiol causes heart attack or stroke or clots, increased risk. It's Premarin, okay? And then the next one is breast cancer and prostate cancer. Like, just stop. We're just stop, okay? So I think prostate cancer with men and testosterone is pretty much out the door. Like, I think there's only a couple people still spouting that off. I've had a couple guys come to me with previous prostate cancer, and I had one guy that I had to send to urology last year, follow at the end of this last year, with an elevated PSA for prostate, and the urologist was like, "We're not worried, keep doing what you're doing." Testosterone in men does not cause prostate cancer.
The tricky part is that even after it's been disproven, it persists for years before it lingers around, like this. On the metabolic health side, they talk about, the high acidity in your blood from a ketogenic way of eating. It's not true. They're confusing or conflating ketoacidosis with ketosis. We've talked about it before, and it's been disproven, but it still lingers around out there. And part of it is, so let's be honest, is some of these industries that are they have these protectionist mechanisms built in, and so they want to try and shun and ostracize people who are openly talking about this because they want to maintain that status quo and keep making their money as long as possible. Mm-hmm. So I'm sorry, I know got off on a tangent there. But.
Well, and then breast cancer. So I just had a new patient in this week. I think she was in her 40s, but she said currently her mom is finishing up treatment for hormone receptive breast cancer. So progesterone and estrogen receptive breast cancer. So I naturally say, well, how old is your mom? 75. Is she on hormones? No. At 75, I have seen enough labs. I have seen tens of thousands of labs. 75-year-olds do not make estrogen, and they do not make progesterone. In fact, 40-year-old women do not make progesterone. They do make estrogen. But breast cancer is caused by so many things. First of all, alcohol. Second of all, insulin, metabolic dysfunction. And then also, there's so many endocrine disruptors in our environment. And it's really sad because we could try all day long to get rid of those. And even if the government outlawed them today, we were just talking about this, it'd probably take 50 years or more for them to go away from our soil and everything else that they're in. Red dye, birth control pill in streams and lakes and fish.
Well, DDT in the environment that's still lingering is probably close to that from back in the 1960s. So we're we're up there already.
Yep. And then the length of time that a patient can be on BHRT or the age to start. So based on the Women's Health Initiative, which is a completely flawed, no one should even mention the Women's Health Initiative anymore. But based on that, 65 and older can't be on hormones, and you can't be on hormones more than 5 years. That is a position statement from the North American Menopause Society and the ACOG, the American College of Obstetricians and Gynecologists. They're talking about Premarin and Provera. They say 5 years, no more than 5 years. It is best, and the Women's Health Initiative showed that there were problems, but those women waited, they were 63 was the mean age. So it's better to start hormones early on, but it doesn't matter what age you start bioidenticals. You don't want to start pregnant horse pea at, like today I saw a 79-year-old that's just coming in. You don't want to start her on Premarin, but you could start her on bioidenticals. So there is no certain age and there is no time limit. I have been on them since, I think it's 12 or 13 years now.
Yeah.
You were a little after me, I think.
Yep.
So, and back to breast cancer. If hormones cause breast cancer, we females would also not last past 21. Males wouldn't last with prostate cancer, and we wouldn't last with breast cancer. Yep. There's also a myth that if you have breast cancer, you can never go on BHRT your whole entire rest of your life. Well, that's not true either, and there are good studies that show women going on hormones after breast cancer, and then women that have stayed off of hormones after breast cancer, there's no increased risk of breast cancer recurrence between the two groups. Now, I have a lady, I just called in all her stuff today. She is currently fighting estrogen positive breast cancer, and she's doing all alternative stuff, like ivermectin and Fenbin and all that other stuff. I gave her progesterone and testosterone. I just didn't give her estrogen, but you certainly can have the other stuff. Oh, and back to the certain age, no one after a certain age. I have a patient who's 65, and I just saw her for the first time after prescribing hormones. 65, she's a retired RN. She was still having hot flashes and night sweats up until the day she saw me. So she sat down in my office yesterday and said, I'm finally not having hot flashes and night sweats. And I look and I'm like, 65? These guys and girls would let you, they just act like, it'll go away. Don't worry. It'll go away. Hot flashes don't last forever. She's 65. Mm-hmm. I went into menopause at 50. That's 15 years of dealing with hot flashes and night sweats. That's not nice. And then lastly is you're too young to have hormone issues. We all just know that's not true. First of all, if you have menstrual migraines, PCOS, PMDD, which is premenstrual dysphoric disorder, endometriosis, PCOS, those are all hormone problems. And you have that essentially from birth. Okay, so those are low hormone issues, and it's really low progesterone. So menopause starts anywhere between 45 and 55. Now, I do occasionally see premature onset of menopause, but 45 to 55 is menopause. And hormone problems can start 10 years before that. That's 35 years old. Okay?
Wow.
So you're not too young to have hormone issues.
Yeah.
So if you want more information on that, look in the description and in the link we always put up, but I've done a couple podcasts. You can go listen to more in depth about this stuff. The book I always recommend to people is Estrogen Matters by Avram Bluming, Bluming. He is a radiation oncologist whose wife got breast cancer. He told her that you can never go on hormones. After a few years, she came back to him and said, you better do something because I can't live like this. And so he went and pulled all the data and all the research and was shocked and appalled that he parroted what he used to parrot based on no science at all. And listen, when you're going through med school and nurse practitioner school, it's hectic, it's hard, it's stressful. And you don't come out of school with $300,000 and $400,000 in debt thinking what I learned might be wrong. You think what you learned is gold, and that is the end all be all, and that's it. And you know it all now. And then the other book, and I haven't read this one yet, but Mary Claire Haver, she just wrote a book called Menopause, and she's all over social media. She's an OBGYN specializing in menopause, and she is all over talking about exactly what I'm saying right now. Do not be fooled. If you want hormones, go on hormones. If you don't want hormones, don't go on hormones, but don't let your provider sway you not to go on them because of scary health risks when that's not true. And also it's irritating sometimes when sometimes I'll hear providers like on a reel on Facebook or whatever say, well, we just got to figure out which women need hormones. Well, let me think about it for a second. Every single woman is going to go through menopause, 100%. There's not one woman that's going to be spared unless she dies before menopause, okay, obviously. But there's not one woman who's going to lose estrogen completely. And estrogen creates health from osteoporosis, Alzheimer's and dementia, cardiac disease, bone shriveling up, UTIs, vaginal dry. I mean, what do you mean which woman needs it? Every woman that goes through menopause is going to need it.
For sure.
Everyone that goes through menopause is going to go through perimenopause. And I'm not saying all women are hot messes. I have seen an occasional woman that comes in because her friend says you just need to go get checked out, but she's honestly not having any problems. This is perimenopause. And I'm like, you don't need hormones right now. But even if you're postmenopausal and not having issues, you need hormones because you want to protect your bones and your brain and your heart. I had quite a few osteoporosis cases in a week, probably 3 weeks ago, and one lady kept having spontaneous vertebral fractures when she would stand. Like, that's bad. That's bad.
For sure.
That's all I got.
Right on. Well, if you guys are interested in finding a provider that does bioidentical hormones similarly to the way Teresa does it, worldlinkmedical.com. That's going to be down in the description and or the comment section. We'll drop those links. There's links to that and a whole bunch more in there. So check those out. And if you guys haven't already done so, please consider liking and subscribing on our different channels that we've got going on. And if you're all good, I'm good.
I'm good.
All right, folks. Well, we're going to wrap this up for tonight. As always, we love you guys. God bless you. We'll see you next time. And remember, food matters.
Bye.
Bye, guys.